Hello everyone, my name is Filipina Santos and today I'm going to present my Capstone Proposal project that will outline critical information revolving my chosen topic for this Capstone project. So let's get started. So hospital around the globe faces many healthcare employment challenges that have a significantly detrimental impact on a healthcare organization's success. One of the healthcare employment challenges that has a real bottom line impact is high turnover rate. So turnover refers to the number of employees who leave an organization, and these leavers must be replaced by new employees that can be costly and disruptive to a healthcare organization's productivity and success. So for this capstone proposal, this proposal will seek to address the issue of high healthcare staff turnover rate and identify exactly the factors that contributes to this phenomenon and propose methods and initiatives that will improve healthcare facilities turnover rates. So for the background of the project, the project setting will be at the Loma Linda University Healthcare Clinical Trial Center. And my project mentor is Mrs. Celerina Sevilla, who works for Loma Linda as a Senior Regulatory Affairs Specialist. So what's considered a high turnover rate depends on the industry. In a healthcare field, expected turnover rates can vary. In the case of my mentor, Mrs. Sevilla of Loma Linda University, California, high staff turnover rate is a huge problem. Mrs. Sevilla explained that when an employee leaves, an organization must replace these leavers with new employees, but constantly replacing employees can be really expensive. And the healthcare facility, as they have to spend money on recruiting, interviewing, and also training new hires, which can also plummet productivity because it will take time for these employees to grasp the new job. So for them to be able to tackle like these new positions that they have. So making high staff turnover rate a burden in the healthcare industry. So there are several factors contributing to this high staff turnover rates. So this includes heavy workload, lack of appreciation, and poor compensation. So for this capstone project, this project will address these three issues and propose methods and initiatives that will help improve the high staff turnover rate. So for the needs assessment, this capstone project will need a short employee engagement survey. This survey asks specific questions about how the staff of Loma Linda University feels about their institution. So since this assessment or survey was done at the beginning of this year, Mrs. Sevilla will let me access the survey so I can review it, and that will ultimately help in determining and identifying the proper methods to use to improve the organization's high turnover rates. So for the stakeholders, we have three stakeholders for this improvement project, and they are the clinical research staff, human resource department, and the finance department. So the clinical research staff are the individuals who want to support this project 100%. They have major influence in the success of this improvement project, as their participation in a short, employee engagement survey will provide understanding on how they really feel about the organization that will then help in determining and identifying the right approach and method to improve the high staff turnover rates. However, the clinical research staff are required to answer the survey to the best of their ability with honesty and elicit truthfulness. For the human resource department, our second stakeholder, and its staff, it is crucial that even though they might not be, easily swayed by this improvement project, they must be informed. Informing them about the project and its goals will definitely help because for this improvement project, because laying the outcomes with them, they can actually grasp and understand the whole process and eventually support the project. So lastly, the finance department. So for the finance department and its personnel, there are the individuals that I believe may resist to this improvement project, because since improvement projects like this will cost healthcare organization money, they might not think this project has a value and for that could negatively impact the organization's budget. So an appropriate approach to this resistance is to inform them about the detrimental and damaging impact of high turnover rate to the organization. So this I can explain to them about recruiting. This is expensive, hiring, interviewing staff, all these have potential damage for the organization. And then laying it out to them will also important, as this approach can lead to the finance understanding the turnover phenomenon and the benefit of employing this improvement project. So these will lead us to our project goals. So this capstone project has 3 project goals. One is to identify the causes of high turnover rates. So extensive research will be conducted using credible resources to identify the root causes that will lead to their second goal, which is determining the best possible solution and methods to improve high turnover rates. So the methods and solution will be focused on the employee engagement survey to determine the needs of the staff, that in turn can lead to identifying solutions and methods to improve high turnover rates. The last and final goal of this project is to ensure the improvement initiatives, such as the methods and the solutions, will be continuously measured, maintained, and adjusted as necessary. So that is really, really important. So the next one will be our project requirements and tool. So for this capstone project, the requirements and tools is the employee engagement survey coming from the Loma Linda University Healthcare. This is one of our tools that we will use. This survey will provide critical information that will act as a guide in determining the suitable methods for solution. And then we also have the credible journal and research article that I will discuss in a little bit, that will also be needed in identifying the root causes of high turnover rates. And then we will also incorporate the quality process called DMAIC. Actually, I've already been using it because it helps me gather my thoughts, and then organize and focus my attention to every single detail. So we have defined, which we already use. We have defined a problem to be the high turnover rates, and then next is measure. We will assess the current process that Loma Linda has. And then we'll analyze, identify the causes of high turnover rates using our credible sources and a research article. And next, improve, which will determine the possible solution. And then finally, control, which is, like I said, really, really important, because once all these are laid out, the improvement projects are all laid out, we need to make sure we maintain the solution and adjust as necessary. So that will lead us to our literature review. So to determine some of the major causes of high healthcare employee turnovers, the literature review will begin by searching for databases that will provide a variety of trusted, peer-reviewed articles. The searches will be mostly conducted using Loma Linda University Library database and the National Library of Medicine database. After reviewing several articles regarding staff turnovers, I found the 5 peer-reviewed articles next that I would discuss that will definitely be helpful for this project. I determined that these articles will be most helpful by utilizing the CRAAAP scale. So as you can see in here, we have the currency. These articles, I believe, have all published within the past 9 years, as it says on the articles, and the information they are providing are current. So relevance, these articles are about potential causes and consequences for high healthcare employee turnover rates. We have authority. I used Loma Linda University Library, and through that, I was able to access some of the peer-reviewed articles from the National Institute of Health, Journal of Nursing Management, Journal of Nursing Scholarship, and the Journal of Advanced Nursing. Accuracy, I really believe that all trusted sources, as they have existed for many years, have been used daily by numerous healthcare professionals. Additionally, the researches performed in the peer-reviewed articles contain a good amount of data that was collected for a long period of time. So next and last will be the purpose. The purpose of the peer-reviewed articles was to determine the causes and consequences for high healthcare employee turnovers, and this continues to be a growing global concern. So This is the first article that I'm going to be using. So this research study was performed in several health agency in Philadelphia. In this research study, clinicians and supervisors were recruited to complete self-report measures. And after 1 year of their completion of the measures, their organizations were conducted and were asked to provide information on which of the clinical and supervisors that had completed the measures left the company. So the personnel that chose to participate completed an interview about their reasons for leaving and their current job situations. And as a result of this study, it was determined that one of the largest causes of these clinicians and supervisors leaving their positions was organizational factors such as lack of organizational support, high expectation in this organization. So another large cause is also financial reasons. So this is really, really important for my for finding the root cause of high turnover rates. So will definitely be helpful for my project, and I will also be using this article. This is a cross-sectional design study with a survey that was performed for 3 months to determine the impact of nursing managers' role on stress they experience at work and on their quality of life. This article determined in this study that this responsibilities was caused to become emotionally tired and very dissatisfied with their jobs. So that's very helpful too in gathering information about the root cause of high turnover rate. The third one will be this research study that examines how changes in the workplace affected certain aspects of the organization, including employees' decisions to leave. They collected data from Belgian hospital for 18 months that showed high turnover rates, and some of the causes are emotional exhaustion, workloads, low compensation, and exhaustion. Yeah, these are really, really good. I'll definitely be able to use this one. And we also have this cross-sectional design study that was performed to look at how nurses' intention to leave their workplace relates to the quality of their work life. So the data was collected from 7 hospitals for 3 months, and the study shows some of the predictors of staff leaving, which is again emotional low compensation, workloads, and poor poor healthcare um, organization. Yeah, I'll definitely be able to use that too. And we also have this final one. So this study was performed to look at job satisfaction and burnout that's experienced by healthcare professional, and evaluate it and then use it to do some surveys. Was sent over to 95,000 experienced nurses by mail. So the study found that patient satisfaction is much lower in institutions where many nurses feel burnt out and dissatisfied with their work conditions than in other institutions. So these are the five of the articles and research study that I'll definitely be using for my capstone project to find the root cause of high turnover rates. So that lead us to our biblical perspective for this project. So, employee satisfaction is quite simply a measure of level of contentment an employee feels with their job and their organization. This satisfaction is vital to the organization's success, and these all begins with appreciation, kindness, and respect. All employees want to be appreciated, treated with kindness, and respected. You know, as a healthcare professional, we are given the responsibility not only to ensure our organization achieves its goal and purpose, but also to ensure our employees are appreciated, respected, and treated with kindness. After all, organization won't achieve its purpose without the hard-working employees in its back. As a follower of Christ, we are also given a task and was commanded to respond to everyone with respect, appreciation, and kindness. So in John 13, verse 34, a new commandment I give to you, to love one another just as I have loved you. You also have to love one another. By these, all people will know that you are my disciples, if you have love for one another. So we must remember the godly way of life. It begins and ends in our attitude toward other people. In every area of our life, we should treat others with kindness, respect, and appreciation. So in conclusion, the impact of high staff